Welcome back. Now, Dr. John Campbell, who's also a familiar face on this show, says the evidence is physical. It exists. You can see it, feel it, put it under a microscope. It's real. He's referring to blood clots being found by coroners, morticians, and those who look after the bodies of the dead. Dr. John Campbell joins me now. Hello, John. Thank you for making time.
Always a pleasure, Neil. Thank you.
What are we looking at? What are we seeing? And I think we have footage and imagery to give people a glimpse.
It really is like something out of a low-grade novel, Neil, isn't it? You've got this new, or apparently completely new pathology being found in dead bodies around the world. And we know that these have been found, these strange, mysterious, long, rubbery white clots have been found in bodies in the United Kingdom, the United States, Canada, New Zealand, Australia. Now, I've actually heard about these some time ago, but I didn't realise how abundant they were. And then I was interviewing Major Tom Haviland, who's a data analyst in the States. And he's actually reached out to 269 embalmers with an average of 15 years experience each, embalming about 100 bodies a year on average per person. And in the year 2023, 73% of these embalmers have observed these strange, white, stringy, rubbery clots. Really quite incredible. And if you take into account the embalmers that didn't see any, it was still in 20% of the dead bodies. And it seems to be pretty similar in the United States and in the United Kingdom. And we really don't know what these are. These are a new pathology. And as you said in the introduction, this is real. It's not a bad story. These rubbery clots that can be an inch long or can be up to 30 inches long are there and have been pulled out of the arterial systems and the venous systems of dead bodies. And there's some anecdotal reports of them being pulled out of living bodies by surgeons as well. But we know for sure in about 20% of dead bodies. And these didn't occur prior to 2020. So previously they'd never heard of. In 2020, some people saw very small numbers, but then lots in 2021, 2022, 2023.
As someone immersed in the medical world, the medical fraternity, do you get a sense that anyone anywhere is putting serious consideration into all of the possible explanations for where something new has appeared in the last handful of years?
Not really. I don't really get that impression, Neil. And in fact, the way that postmortems are done, well, firstly, there's fewer postmortems done in the United Kingdom at the moment, and I believe in the United States. But the way they're done, they take out blocks of organs and don't really analyse the vascular system in that much detail. And one of the undertakers I was talking to on this, he'd actually got a body that had been post-mortemed, autopsied, came back into his facility. He was trying to embalm this body because relatives wanted viewings. And as he was looking at the body and he couldn't get the embalming fluid around the body. And he pulled out a 30-inch clot from the femoral artery in the leg. It really is quite incredible. The big question, of course, is when did these clots form? Were they forming or starting to form in the months, weeks, hours before death? Is it a peri-death phenomena? Is it a post-mortem only phenomena? It does appear that there are some cases where these occurred in life. But either way, it doesn't matter. I've talked to about 20 doctors around the world now, including 3 or 4 medical professors, a couple of pathologists and many doctors and physicians and surgeons, and they'd never heard of this. This does appear to be a genuinely new pathology.
John, bear with me while I involve Tonya, who's in the studio with me. What do you think, Tonya? You look at a sudden emergence of a new medical phenomenon.
Global phenomenon. And what have we done
Would you like to speculate?
Well, what have we done differently globally that we haven't done before 2020, 2021? We all know what it is. We all know what it could well be. And yet we are restricted from saying out loud what we truly believe it to be because we don't live in a free world anymore. What's the big thing that we've done different? We all know it.
John, how is it? How does it feel to be operating in a world where speculating about things that appear quite obvious is somehow forbidden ground? You know, this is the new reality for the likes of us.
It's rather frustrating. I mean, in the 1950s and early 1960s, Austin Bradford Hill and Richard Doll believed that lung cancer might be caused by cigarette smoking. And in 1965, Austin Bradford Hill came out with a set of criteria where we can adjudicate these sort of things. And we have these criteria. We have the pathologists, we have the histologists, we have the cytologists. We could analyze this properly. We could use these Bradford Hill criteria. Is there a correlation? How big is that correlation? Is there consistency between different countries? Are there other possible explanations? Does a particular cause follow a particular cause? Is the effect come after the cause and not the other way around? And this is clearly an effect of something. Is there this temporal correlation? Is there a biological gradient? Are there plausible mechanisms? Is there coherence? Is there experimental evidence? Is there analogy? And potentially, is there reversibility? We know all these things. We could do all these things, work out what the heck is going on here. And it really seems strange that this isn't all over the medical literature as a brand new pathology.
Tonya, we do know that, billions of people around the world had in the last few years a new medical product introduced to their bodies.
Yes.
And yet it would appear from what John's saying that no serious consideration is being made about the emergence of a new symptom, a new post-mortem symptom.
Because we are run and governed by Big Pharma. And Big Pharma have a lot of money to make, and they don't want us to actually have this open and honest conversation about what is suddenly appearing in our bodies, in the bodies of our children, the bodies of our parents.
And while I have you, John, the new way of calculating excess deaths to which I referred, just a quick answer. How much of a surprise was that for you?
Not much of a surprise, Neil. It's good to know that so many fewer people died in 2023 than we thought had. I thought we had a bit of a problem for a minute, so it's all quite a relief. I mean, it just beggars credulity, doesn't it? We don't like the figures. Politicians are being embarrassed. So, hey-ho, you change the way that these deaths are being
Running
reported.
out of time, John. Credulity well and truly troubled. Thank you so much for being with me, if only briefly, John. I'm afraid that's really all it is, all I have time for this week. A big thank you to all of my guests, especially you, Tonya. Thank